वेल हम यहाँ B20 की समिट में हैं एंड लगातार कॉर्पोरेट वॉइसेस के साथ बातचीत कर रहे हैं. नाउ विद मी इज शोभना, नेम अगेन वी ऑल नो. बहुत ही बड़ा आपका रोल है व्हेन इट कम्स टू द सेक्टर दैट यू रिप्रेजेंट. शोभना, हम बात कर रहे हैं फार्मास्यूटिकल, हॉस्पिटल्स, एंड आई थिंक फ्रॉम द ओवरऑल पॉइंट ऑफ व्यू ऑफ जिस तरह से इंडिया ने यहाँ पे एक अपनी अंडर देयर सेक्रेटेरिएट हम बहुत सारे एजेंडाज की बात कर रहे हैं फॉर द वर्ल्ड. B20 में इंडिया का जो रोल है हेल्थ केयर में स्पेशली, आप कैसे देखते हो? व्हाट इज इट दैट विल बी आवर स्ट्रेंथ जो हम दुनिया को आगे बढ़ा सकते हैं?
सो पहले जो what we did ये B20 के लिए set a new bar. The very fact that it's been around, G20, B20 has been around for decades now, but nobody has been able to expose. They take one area, but हम जो करे, the I really commend the government, is that they have introduced the world not to Delhi. They've introduced the world to Bharat. That's the biggest thing of every single Indian. Not just India may we know what we are to the world, but the world now knows so much more about India. So that's fantastic. ये agenda, serious agenda हो रहा. And इसलिए there was more than 7 main sectors that we spoke about. Health, of course, is a very important mission. Women, skilling, all these have been part of. And I think that getting ministers to agree, क्योंकि ये इंडिया का एजेंडा नहीं है, and इंडिया का एग्रीमेंट का भी बहुत मुश्किल, because it's a state subject. So even to get Indians to agree on health is a very difficult thing. But now what we have to do is to get 20 countries in the world to sign off. What are the things that we can really sign off? I think bad experience of the suffering of the pandemic have made people understand and come to the table. क्योंकि ये नहीं हो सकते तो we don't have a world to live in. They won't be a G20. Same thing with climate change. Same thing with women empowerment. So I think they've come to a stage that if we don't agree to some fundamental things, we're not going to have that world to live in.
Thankfully, as you said, कि ये recognize हो गया पैंडेमिक के बाद, और लोगों ने इसको बहुत सीरियसली अब एज ए वेरी इंपॉर्टेंट एजेंडा रखा है अपने पॉलिसी मेकिंग में. इंडिया की जहाँ पॉलिसी की बात आती है, स्पेशली इन दी हेल्थ केयर स्पेस, मैम, आप कैसे देख रहे हो? प्रोग्रेसिवली हम आगे बढ़ रहे हैं? कहाँ गैप्स अभी भी हैं जो हमें फिल करने हैं? एंड कॉर्पोरेट इंडिया यहाँ पर क्या रोल प्ले करेगी?
So पहले तो government has definitely been stepping up. The investment is always a challenge. हम जो invest करते हैं government में in healthcare is probably the least in the world, but I'm not complaining, because it's actually running the largest health insurance for the underserved in the world. So हम क्यों complain करना? There are more than 500 million Indians that have access to good health care. For the high end, they can come to Apollo Hospital. So I think that is something that they've done. Now, what's the responsibility? I think the responsibility is not just Indians, but also of governments and corporates, that we must make sure that we invest in keeping people healthy. We can't put that many hospitals. So ये mental health का, ये pre-diabetes का, invest more in exercise, doing things. If we can do that, the longevity, because youth are going to live for a long time now.
So they better be healthy.
Yeah, they better be healthy. Otherwise, we'll be a rich country with sick people.
No, we don't want that. Thank you so much. Lovely speaking with you always.